I'm Aubrey.
I'm Abby.
And I'm Macy.
And I'm Abby.
We're a part of Central Elementary and still be in CMPS team.
Our project is STOP, STOP,
which stands for
Slaying the Opioid Problem.
and our slogan is Stop while you still have a chance.
We are so glad to have a chance to speak with you today about Edgewater.
Okay. Our first question that we have is, where are you located at?
We are located, our main office is in Moorhead, Kentucky, but we have offices and facilities in Pikeville, Paducah, and Moorhead.
Do you have services for both men and women?
We do, and we just opened up an adolescent facility for males ages 13 to 17.
Okay, what type of services?
We have inpatient, partial hospitalization, IOP, which is intensive outpatient, and then outpatient services as well.
Does your program accept insurance for patients with insurance, or do payment plans for those who don't have insurance?
Yes, we do both.
Are your programs or like your services inpatient, outpatient, or both? Or like
both? Yes, ma'am.
How long does it take to finish a program and the steps?
So it can take anywhere from 90 days to 6 months.
How long is the program and how often do they meet for classes?
So if they're inpatient, they'll meet for classes every day. And then as they progress, they'll do like a couple of times a week, to just maybe like once a week. And they also will have individual counseling as well. And that kind of varies depending on what level of care they're in too. So if they're inpatient, they'll meet weekly. As they progress, they'll go every other week to once a month. And then if they're outpatient, it just depends on, what their needs are.
How long does it take for an addict to complete the program?
So it just depends. It could take 90 days or it could take up to 6 months. It just depends on them and how long they're wanting to complete and things like that.
What requirements are needed for an addict to receive inpatient services or outpatient services?
They just need to be an addict who's looking for help or who's been court ordered to treatment. There's not really any special boxes we have to check or anything like that. If they're needing help, that's what we're here to do.
Are any additional services provided with addicts in your program?
So do you mean like, do we help them with medical care and things like that?
So like
Yep.
mental health, yeah, basically.
Yeah, so we provide counseling. I'm actually a counselor. So we do mental health therapy. We can help them with case management, so making sure that they know how to find a place to live, how to find a job, life skills and things like that. We also have nurses and a doctor. So we make sure that they have medical care, and if they need other appointments, we help them do that as well.
Additional help provided once an individual has graduated from your program?
So we have a program called Transitional Living, or Edgewater Transitions. So they can either live in our Edgewater Transitions, or they can still receive services through us where it's an outpatient setting, where they can still get counseling and group if they need it with us. And we have a sister program called Raven Cares, where they can also get help with housing and also still receive services.
Are educational opportunities provided to individuals enrolled in your programs?
So that's something with our adolescents. We do provide school for them 3 hours a day, and then also for our adults, we can, with our case management, set them up with the career center so that they can take their GED if they need to, or if they want to take college classes, they can do that as well.
What is the usual amount of addicts enrolled in your addiction center?
Oh, man, our men's campus can house 90 something. I don't know the exact number. And our women's, the small building can house 24 and the large building houses 70, I think. And then we have 12 beds for adolescents.
Can we locate your center on social media or like just anywhere on the internet?
Yeah, have a website. We're on Facebook. I think we have a TikTok, but we're not very active on it. But yeah, we're on social. We're on the internet.
What made you decide to work here?
So I just really like to help people, and I have some personal experience with people that I love and care about. So I decided that I wanted to see if I could help.
Do you have an online program for addicts?
An online program?
Mhm.
We do not. We do kind of help people. We introduce them to Narcotics Anonymous, which is a 12-step program. And they have Zoom meetings that they can be connected with that is not affiliated with Edgewater. That's just like a 12-step program that we use to help addicts. Um, Hold on just a second. Sorry, I had to investigate that noise. But Edgewater does not have like an online program.
Additional information that you wish to share?
I think that we've covered everything pretty well. You guys had really good questions.
Thank you.